Ahead of the observance of World Polio Day, October 24th, the Pan American Health Organization, PAHO, is celebrating the 30th anniversary of the certification of the eradication of wild polio virus transmission in the region of the Americas. In 1975, the region reported nearly 6,000 cases of polio. The recent statement released by PAHO notes that thanks to child vaccination and sustained surveillance implemented by governments with the support of PAHO and partners, the last case of wild polio virus was detected in September 1991 in Peru. In 1994, the region was certified as free of the disease. PAHO's director, Yabas Barbosa, said, quote, "Achieving a milestone like this is not easy. It involves a lot of work, commitment, and tenacity from thousands of healthcare workers, researchers, partners, and all the people responsible for vaccinating their children," unquote. However, Dr. Barbosa warned about the persistence of poliovirus in other parts of the world, noting, quote, "Until we eradicate the poliovirus globally, we must maintain a high vaccination coverage and adequate surveillance to detect any imported cases," unquote. Polio is a highly contagious disease that affects the central nervous system, causing acute flaccid paralysis. Although most of the infections are asymptomatic, in 1 in 200 cases, the virus can cause permanent paralysis in the legs or arms. Globally, polio cases have declined by more than 99% since 1998, when an estimated 350,000 cases were reported in more than 125 endemic countries. There are now just 2 endemic countries, Pakistan and Afghanistan. However, the polio virus does not respect borders and can find groups of unvaccinated or under-immunized children, which could lead to outbreaks. Dr. Barbosa highlighted the impact of immunization programs in controlling and eliminating vaccine-preventable diseases and emphasized the continued support of governments and partners such as the Rotary Club International and the U.S. Centers for Disease Control and Prevention, CDC. Despite the progress, the PAHO director mentioned that misinformation and distrust, along with the effects of COVID-19, continue to affect vaccination coverage in some areas and populations. In 2023, 87% of children in the Americas had received their 3rd dose of the polio vaccine necessary for full immunization, a recovery from 83% in 2022, but still below the recommended coverage rate. According to Dr. Barbosa, to prevent the reintroduction of the virus, it's essential to continue working to achieve sustained coverage of more than 95% uniformly in each country. As the world moves towards the total eradication of wild polio, efforts are increasingly focused on mitigating the risk of vaccine-derived cases. On rare occasions, in under-immunized population, the live attenuated virus originally contained in oral polio vaccine can mutate and become a circulating vaccine-derived poliovirus. This virus, as it replicates in the gastrointestinal tract, can spread through feces and sewage, circulating in the environment and exposing unvaccinated individuals who are susceptible to contracting polio. The PAHO director called on all community leaders, healthcare workers, educators, among others, to join the effort to eradicate the polio virus and other preventable diseases. He called on all, while celebrating 30 more years of free wild polio in the Americas, to reaffirm their commitment to a polio-free world. Stanley Lucian for the HTS News Force.